Depression is more than just sadness. It's a complex condition that goes far beyond the occasional blues. It's not simply feeling down for a day or two. It's a heavy, persistent weight, a burden that can feel impossible to shake off, clinging to you day after day. This weight can make daily life feel overwhelming. Simple tasks become monumental challenges, and the energy to face the day seems to vanish. It's not a passing mood, a fleeting moment of unhappiness that quickly fades away. Instead, it's a serious medical condition, recognized by healthcare professionals worldwide as a significant health concern. It's a condition that affects how you think, altering your perceptions and clouding your judgment. It impacts how you feel, coloring your emotions with negativity, and ultimately how you function in your daily life, hindering your ability to work, socialize, and even care for yourself. Unlike normal sadness, which is often triggered by a specific event and eventually subsides, depression lingers for weeks or months, casting a long shadow over your life and refusing to lift. It often persists without an obvious cause, making it even more confusing and frustrating for those who experience it. Emotionally, it brings deep sadness, a profound sense of despair that can feel all-consuming. There is a loss of interest in activities you once enjoyed, leaving you feeling empty and disconnected, and it fosters feelings of worthlessness, leading you to believe that you are somehow inadequate or undeserving of happiness. Physically, it can disrupt sleep, leading to insomnia or restless nights that leave you feeling exhausted. It can also affect your appetite, causing a loss of interest in food, or conversely, leading to overeating as a way to cope with your emotions. And it can cause unexplained aches and pains throughout your body, adding to the overall sense of discomfort and unease. These symptoms are often invisible to others, hidden beneath a facade of normalcy. This makes depression an isolating struggle, as those affected may feel alone in their suffering, unable to connect with others or express the depth of their pain. Recognizing the difference between sadness and depression is the first step toward understanding the condition and breaking down the stigma that surrounds it. It's the first step toward compassion and support, allowing us to offer empathy and understanding to those who are struggling. Depression is a whole-body illness, affecting not just the mind, but also the physical well-being of an individual. It's a condition impacting both mind and body in profound ways, highlighting the intricate connection between our mental and physical health. Depression takes many forms, manifesting in a variety of ways that can be difficult to recognize. It's not simply feeling sad, it's a complex condition that impacts thoughts, feelings, and behaviors, each with unique challenges. Understanding these different presentations is crucial for effective support and treatment. Major depressive disorder, often what people think of when they hear the word depression, involves intense symptoms that disrupt daily life for weeks. These symptoms can include profound sadness, loss of interest in activities, changes in appetite and sleep, and feelings of worthlessness. Persistent depressive disorder, or dysthymia, sometimes referred to as high-functioning depression, is a chronic, low mood lasting years. Individuals with dysthymia may experience a persistent sense of sadness or emptiness that never quite lifts, impacting their overall quality of life. Other types include perinatal depression during or after pregnancy, a serious condition affecting many new mothers, and seasonal affective disorder, triggered by changes in sunlight. This form of depression typically occurs during the winter months when there is less natural light. Depression can affect anyone, crossing all societal boundaries regardless of age, gender, or background. It's a universal human experience that can touch anyone's life. It often begins in the teens or 20s, a critical period of development and self-discovery, but no one is immune. Even those who appear to have it all can struggle with depression. Women are diagnosed more often, possibly due to hormonal factors and societal pressures, but men may express symptoms differently. They might exhibit anger, irritability, or engage in risky behaviors instead of sadness. With over 280 million affected worldwide, depression is a global health crisis. Open conversation and support are vital. Breaking the stigma surrounding mental health is essential for encouraging people to seek help. Recognizing its many faces, understanding the nuances of each type, helps us respond with empathy and understanding. It allows us to offer appropriate support and encourage those struggling to seek professional help. Depression's causes are complex. Brain chemistry, genetics, and life events all play a role. Neurotransmitter imbalances can affect mood, just as genetics can increase vulnerability. Trauma, chronic stress, and certain medical conditions can trigger or worsen depression. Even some medications can contribute to symptoms. Diagnosis isn't done with a blood test, but through careful evaluation by a healthcare professional. They'll ask about your symptoms, history, and may use questionnaires to assess severity. Understanding these factors helps guide effective treatment. Depression is a medical issue, not a personal failing. The good news: depression is treatable, and recovery is possible. Psychotherapy, especially cognitive behavioral therapy, helps change negative thought patterns. Medication can correct brain chemistry imbalances for many people. Often, a combination of therapy and medication works best. Self-care matters. Regular exercise, healthy eating, and good sleep support recovery. Mindfulness and small daily routines can help restore stability. Building a support system, friends, family, or support groups, eases isolation. Reaching out is hard, but connection is a powerful step toward healing. You don't have to face depression alone. If you recognize these symptoms in yourself or someone else, it's important to acknowledge these feelings. Reaching out is a sign of strength, not weakness. It demonstrates courage and a willingness to seek support during a challenging time. Start by talking to someone you trust, whether it's a friend, family member, or mentor. Sharing your feelings can be incredibly cathartic, or make an appointment with a doctor. They can provide a professional assessment and guide you toward appropriate treatment options. Set small, achievable goals. Baby steps are still steps. Every step forward counts, no matter how small it may seem. Celebrate those victories. If you're supporting someone, remember that your presence and understanding can make a world of difference. Listen without judgment. Offer a safe space for them to express their feelings openly and honestly, and encourage professional help. A therapist or counselor can provide specialized support and guidance. Recovery isn't linear. There will be ups and downs along the way, but progress is possible, and setbacks don't negate the positive steps you've already taken. Depression does not define you. It's a part of your experience, but it doesn't diminish your worth. It's something you're experiencing, not who you are at your core. Remember your strengths and resilience. Millions have found their way back to hope. They've navigated similar challenges and emerged stronger. You can too. Believe in your ability to heal and find joy again. Help is available in many forms, from therapy to support groups to online resources. And you deserve to feel well, to experience peace, happiness, and fulfillment in your life.